As biologically minded dentists, we strive to achieve all the goals of modern dentistry while treading as lightly as possible on our patients' biologic terrain. So while we work to maximize the positive attributes of our restorative materials, strength, durability, comfort, and aesthetics, we seek at the same time to minimize the negatives, toxicity, immune reactivity, and galvanic stress. Most of us practice dentistry in the belief that biocompatibility of dental materials and procedures is a settled issue. It turns out, though, that our customary materials and procedures range from very benign to extremely hazardous. Some of our all-time favorites, mercury and fluoride in particular, have obvious toxic effects that can be detected even when they are used properly.
Some metals used in dentistry and medicine have no established function in the human body, and in addition to aluminum, which is both a neurotoxin and an immune stimulator, these include gold, mercury, nickel, palladium, platinum, silver, and titanium. Mercury is recognized as being toxic to humans even in low doses, and researchers have identified other materials used in implants and devices as metals of concern, including chromium, cobalt, copper, gallium, gold, iron, lead, manganese, mercury, nickel, platinum, silver, tin, vanadium, and zinc. Researchers have also established that chronic exposure to low doses of metals can elicit autoimmunity in genetically susceptible humans. Dr. Ivan Sturzel and his colleagues have elaborated, quote, "The key factors governing the harmfulness of metals are the cumulative concentration, duration of exposure, and genetic susceptibility. Many harmless metals may become allergens or exert toxicity if administered on a chronic basis," end quote. Source of the quote is from I. Sturzel et al., Mercury and Nickel Allergy, Risk Factors in Fatigue and Autoimmunity, Neuroendocrinology, 1999. Reactions to metal implants and devices can be manifested on the skin or in the oral mucosa, but they can also include more complex immune reactions at the site of the implant locally, at other parts of the body, and or throughout the body systemically. Even trace amounts of metals can potentially cause a reaction in susceptible subjects. Metal ions from these implants and devices are processed both locally and in other parts of the body, which can prompt an immune reaction and inflammation. For citations to support this information, see this source, Just A, Call J, Autoimmune Diseases and Metal Implants and Devices, Champions Gate, Florida, IAOMT 2019. In a 2014 publication, Dr. Vera Stechkel wrote, quote, "Metal-induced inflammation may be involved in the pathology of various autoimmune and allergic diseases where abnormal fatigue, joint and muscle pain, cognitive impairment, and other non-specific symptoms are often present," end quote. The source, of course, is V. Stechel, Metals as a Common Trigger of Inflammation Resulting in Non-Specific Symptoms, Diagnosis and Treatment, the Israel Medical Association Journal, 2014, December. Additionally, Dr. Ivan Sturzel and his colleagues have reported, quote, "Hypersensitivity to metals result in a wide range of clinical and subclinical symptoms such as chronic fatigue, depression, sleep disturbances, and others. Patients with these symptoms often report intolerance to metal earrings and other metallic devices such as jeans buttons, watches, and intrauterine devices." Source, and I. Sturzel et al., Removal of dental amalgam decreases anti-TPO and anti-TG autoantibodies in patients with autoimmune thyroiditis, Neuroendocrinology Letters, 2006, December. One example of how an offending metal can trigger an array of possible reactions is this excerpt from the IAOMT's position paper against dental mercury amalgam fillings for medical and dental practitioners, dental students, and patients that list adverse health effects scientifically associated with dental mercury exposure. You can view the original document for access to specific research articles documenting that the mercury in dental amalgam fillings has been shown to potentially exacerbate and or contribute to each of these conditions, as well as a myriad of other health outcomes. These include allergies, Alzheimer's disease, amyotrophic lateral sclerosis, also called Lou Gehrig's disease, antibiotic resistance, autism spectrum disorders, autoimmune disorders and immunodeficiency, cardiovascular problems, chronic fatigue, fatigue in general, and or myalgic encephalomyelitis and chronic fatigue syndrome, complaints of unclear causation, dermatitis, fibromyalgia, gastrointestinal issues and or irritable bowel syndrome, IBS, hearing loss, kidney disease, micromercurialism, multiple sclerosis, oral lichenoid reaction and oral lichen planus, oral facial granulomatosis, Parkinson's disease, periodontal disease, psychological issues such as depression and anxiety, reproductive dysfunction, suicidal ideations, symptoms of chronic mercury poisoning, systemic lupus erythematosus, and thyroiditis. For detailed citations to support dental mercury's association with each of these conditions, see this source, J. Call et al., International Academy of Oral Medicine and Toxicology, position statement against dental mercury amalgam fillings for medical and dental practitioners, dental students, and patients, Champions Gate, Florida, IAOMT, 2019. Continuing with our example of dental mercury, we can demonstrate how an exposure to a particular material in an implant or device can influence each individual differently based on a wide range of coexisting factors. For example, each person's unique response to dental mercury can be influenced by the presence of other health conditions, the number of amalgam fillings in the mouth and or the number of amalgam surfaces in the mouth, the type of amalgam filling, for example, the specific content of metals, gender, genetic predisposition, dental plaque, exposure to electromagnetic fields or EMFs from magnetic resonance imaging, mobile cellular phones, and Wi-Fi, exposure to aluminum, fluoride, lead, and other environmental toxicants, selenium levels, consumption of milk or alcohol, methyl mercury levels from fish consumption, the potential for mercury from dental amalgam fillings to be transformed into methyl mercury within the human body, and many other circumstances. For detailed citations to support this information, see the source J. Call et al., International Academy of Oral Medicine and Toxicology, position statement against dental mercury amalgam fillings for medical and dental practitioners, dental students, and patients, Champions Gate, Florida, IAOMT, 2019. And also J. Call, A. Just, and M. Ashner, What is the Risk? Dental amalgam, mercury exposure, and human health risks throughout the lifespan. Epigenetics, the environment, and the children's health across lifespans, David J. Haller, Springer, 2016. It is also essential to elaborate upon the association of genetic predisposition with specific adverse effects from metal exposure. Significantly, adverse reactions are more likely to occur for individuals who are genetically predisposed to having lower excretion rates of metals. For instance, it has been found that mercury exposure from dental mercury amalgam particularly threatens individuals with the genetic variants CPOX4, APO3 and 4, and BDNF, which stands for brain-derived neurotropic factor polymorphisms. Additional genetic traits that have been examined for association with health impairments caused by mercury exposure include metallothionein, polymorphisms, catechol-O-methyltransferase or COMT variants, PON1 variants, MTHFR mutations, and other genetic aspects. For detailed citations to support this information, see the source A. Just et al., Comprehensive Review of the Toxic Effects of Mercury in Dental Amalgam Fillings on the Environment and Human Health, Champions Gate, Florida, IAOMT, 2019.